Okay, we are now live. You can go ahead.
Well, good afternoon, everybody. Thank you for being here today and during what is a very busy holiday week. As usual, we'd like to start with a brief reminder for our Spanish-speaking viewers. Jose?
Buenas tardes y bienvenidos. Soy José Landaverde del Condado de Sonoma. Esta es la sesión informativa donde la doctora Mace nos dará una actualización sobre el coronavirus. Esta actualización se está transmitiendo por vivo en nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la publicación de esta reunión en la página de Facebook del Condado de Sonoma. Gracias. Back to you, Paul.
Okay, thank you. Just want to remind you, I'm Paul Gullickson, Communications Manager for the County of Sonoma, and this is our COVID-19 update for Wednesday, December 23rd. I also like to remind you that, as always, during this community briefing, we will be taking some questions from the public, and you are invited to submit your questions either by emailing them to us at publicaffairs@sonoma-county.org. Once again, that's publicaffairs@sonoma-county.org, or by leaving your question in the comments area of the Facebook Live page, and we will those will be passed along to me. We also would ask that if you are going to be joining us as a panelist today, we encourage you to speak loudly and slowly for the sake of our interpreters. So let's begin with another update from Dr. Sundari Mace, Health Officer for Sonoma County. Dr. Mace?
Great, thank you so much, Paul, and thank you everybody for joining us today. I first want to take this opportunity to remind the public about our holiday guidelines. I know people are looking forward to celebrating together, but we also know that holiday gatherings can become super spreader events, and we want everyone to be safe this holiday season. As an example, we can look at what happened after Thanksgiving when many people gathered to share a meal. We know that at least 89 COVID positive cases in Sonoma County were linked to Thanksgiving gatherings. In some instances where individuals gathered with people outside of their household, 50 to 100% of the guests at the gatherings ended up testing positive for COVID-19. In 3 out of 4 of those cases, they were able to verify the presence of a COVID positive individual at the gathering. 20% of those who have tested positive have listed Thanksgiving gatherings as their most probable exposure. And 3% of those cases involved travel inside or outside the state to participate in gatherings. We also want to share the latest guidance from the California Department of Public Health. Traveling to see friends and family during the holiday could increase your risk of infection, and it is not recommended. Do not gather with other households. In fact, gatherings with members of other households are prohibited under the regional stay-home order. Wear a mask when you leave home and when you're with anyone you don't live with. Keep your distance, especially from older family members and those with chronic health conditions. We know this is difficult to say no to loved ones, but we encourage you to do so when saying yes could increase risk for you or the other people that you care about. Consider alternate ways to celebrate this year, such as virtual celebrations with friends or extended family. Drop off holiday meals for older loved ones and those with medical conditions so they can stay home. Don't make someone feel guilty for not wanting to gather in person. Don't ridicule someone for wanting to take precautions. Safe practices over the holidays are especially critical as we continue to see a sharp increase in COVID-19 cases and hospitalizations across the state and in our county as well. In Sonoma County, our rate of daily cases per 100,000 is now 44.4, which has tripled in the past month. The Bay Area's ICU capacity is down to 11.4%, and we're still under a regional stay-home order, at least until January 9th. Finally, I want to share some new developments regarding the county's pop-up testing sites. Beginning on December 28th, next Monday, the private testing company Curative will be operating many of the pop-up testing sites, a partnership that will allow the county to increase our testing capacity, improve efficiency, and speed up turnaround times for testing results. Another benefit for those who go through the testing experience, Curative offers FDA-authorized self-administered cheek swabs instead of nasal swabs. The county will continue to provide bilingual and bicultural healthcare workers at each location to support community members with COVID-19 information and resources. The current schedule enables Curative to provide up to 900 tests per week to county residents in key census tract neighborhoods. Visit socoemergency.org/test to find out more about testing options. On another positive note, we have received 5,800 vaccinations from the Moderna vaccine, or that is doses of Moderna vaccine, and we expect to receive another 3,000 doses next week. We were initially going to receive these vaccines next week, but we're ready to go this week with 5,800 doses. Thank you. We now have time to answer some questions.
Okay, thank you, Dr. Mace. As always, we will now take some questions from the public and from the media, and just want to remind you that we have with us today Dr. Kismet Baldwin, Sonoma County's Deputy Health Officer, as well as Kate Pack, our Health Program Manager for the county's epidemiological team, and Adam Radke, our Deputy County Counsel. Let's start there. We have received quite a number of questions about vaccine. And I think you just answered one of them, Dr. Mace, which is about the Moderna vaccine. She was asking, how many doses of Moderna will your county be receiving? I believe you said we received 5,800 today, and we're going to get another 3,000 next week. Is that right?
That's correct.
Yeah. And we're still receiving shipments of Pfizer vaccine, and we'll probably get another 1,950 next week. Here's a question from Tim. This is probably a question many people are asking right now. He asked, should we tell our son and his girlfriend not to fly up from New Orleans to visit us this holiday season? What do you think?
I think it's a risk. You can see that COVID-19 cases are increasing all over the country. And we know that airport or hubs are kind of a place where people mingle from all over the country and maybe even internationally. So it is a risk to travel, especially by air travel. And even if there is a negative test performed on a single day, it only tells you that person is negative on that day. And if someone has been exposed, as you know, it takes 14 days, up to 14 days to actually get the infection. So there's no safe way really to celebrate with people that you don't normally live with at this time. So I would advise against it.
And here's one other question. Norma asks, why is the Grayton Casino having a private New Year's Eve party when our numbers are rising? Dr. Mace, do you want to answer that one?
Well, the casino has been open all along. They don't really fall under the state's stay-home order since they're a sovereign nation. And they are planning to do things with as much mitigation measures as they can in terms of limiting their indoor capacity to 20% of what's normal, in terms of enforcing facial coverings or masks, as well as social distancing. They have, we in the county have had discussions with them to see what kind of mitigation measures they have in place. They have closed all their bars. They stopped serving alcohol, I think last call by 9:15 p.m. So they've made a number of changes to try to ensure that there is safety. Again, remember, they do not fall under the governor's regional stay-at-home order. Paul, do you want to add anything?
No, only that Dr. Mace and I, we did have a conversation with the Grayton Casino today to find out more about their plans on New Year's Eve, because obviously that is a concern, and it'd be our preference, obviously, not to have a party with 4,000 people indoors. Nonetheless, we do recognize that they are taking as many precautions, and probably more precautions than any casino in the state, and we do respect them for that. And we do not have jurisdiction there, but we are in contact with them and talking about it. And Dr. Mace has provided as much guidance as possible to help them operate as in as safe a capacity as they can. So let's go to Martin Espinoza from the Press Democrat. Martin.
Hi there. I was hoping that you could talk a little bit more about the 5,800 vaccination from Moderna. Do you know how that will be distributed? Is that just for the county's public health, or is any of that going to local hospitals?
Hi, Martin. Hi. So the 5,800 came to the county. The multi-county entities, which are Sutter, St. Joseph's, or so Memorial and Petaluma would fall under that umbrella, and Kaiser received their own allocation of Moderna vaccine. So that is just for the county. And we will, we're still working in our tier 1 grouping. So as we're getting more people, as the planning continues, we will start distributing the Moderna vaccine to some of the groups that are set to be vaccinated in tier 1. So that's how we plan to use that.
Is there going to be an option? I know some people are already saying, I want the Moderna or I want the Pfizer. How are you going to decide who gets what?
I think right now the best option is whatever's available to you. If it's your turn to get vaccinated, they both have similar efficacies, around 95%. They both have fairly similar side effect profiles. And I know when it's my turn, I'll take whatever's available at the time. We don't right now have any reason to only give one of the vaccines to certain people and one to another group. Some of the distribution will rely on who has the capability to store which vaccine. And as you know, the Pfizer vaccine really, there's only maybe 4 places that can store that. And of course, we can redistribute it throughout the county, but we can directly ship to some of our other partners in the county the Moderna vaccine. So they may get more of the Moderna because they can actually store it and keep it in their freezer.
Right. Oh, just one last thing. We talked a little bit about this on Monday, but I had asked questions because now it looks like everybody's kind of getting their it's unclear. The different hospitals are getting their own shipments, so it's unclear the total number of vaccines that are arriving now, or the total number of people that are getting vaccinated. And I think Kate Packers had mentioned the database or that data coming from the state. Is there any, and the county trying to process that, or where are we on making that data available?
I think I'll pass that to Kate as far as our epidemiologists obtaining access to the California Immunization Registry, which is the state system and database for all of the immunizations that are administered in the state. I'll let her speak to that. Otherwise, on the other end, we are going to be reaching out to our healthcare partners to see if they will just let us know how much they got. And how much they've actually administered so far. That might be an easy route if we can make that happen. But Kate, are you able to speak to the care system and how much information we'll be able to get out of that system?
Hi, yeah, so we do have access to the care system. We're working on building reports to get the information out, but we're talking with the state and other counties just to verify the validity of the information and also checking on the data entry status to ensure that any information that we're getting out is the most complete information before releasing that. So we can keep you updated as we get better access to those numbers. And I believe we'll work towards setting up something similar to what LA has done on our dashboard, having some information about the number of doses and how those doses are being distributed so that can be more accessible for people to kind of see where those doses are going and where we are.
Thank you.
Okay, let's take a couple more questions from the public. Haley from KQED asks, can you please let me know what the current ICU capacity is and the number of beds that are available? Kate, do you have those numbers?
Hi, yep, so currently, let's see, for our county, we have 25.7% of our ICU beds available. And information, if you look at the local metrics tab of our reopening dashboard, you can follow both the ICU bed availability for our county and the Bay Area region. Those numbers are updated daily. We're also working to revamp and have a hospital capacity dashboard updated soon so that you can also see trends in that information as well. But for right now, you can see that information each day on the local metrics tab.
Great, thank you. And I'll throw in that I believe the ICU capacity for the Bay Area region, which we're in, is that 13.5% at this point. And for the state, we're down to 1.1%, which is a little scary.
I think as of today, it was more like 11.2% for the
Oh, is that right?
Bay Area
Okay.
region, yeah.
Yeah, thank you. Yeah, it's not good. Okay, we have a number of questions from the public about concerns about our. I mean, obviously, there's a big rush right now in shopping, and they say the stores are packed, and there's concerns about spread in the stores that they're not really monitoring to make sure that they're holding, keeping people safe. Dr. Mace, do you have thoughts on that?
Yeah, I think, to the extent possible, not to go into indoor crowded places would be really important if you want to really protect yourself from COVID. Of course, be wary, make sure people, if you do go into an indoor store for retail shopping, then make sure people are wearing their face coverings, that they're practicing social distancing. You should do so yourself, following general hygiene measures. And remember, you can still shop online and get prioritized shipping if you really are trying to get something the next day or so. But keep in mind, it's okay to shop after Christmas as well and do so online.
And local. And you can get some pretty good deals, I imagine, after Christmas. So you can give some people some homemade gift certificates. That's a good idea. That's something I'm probably going to do. Okay, let's go to Susan Wolbarst. Susan, do you have a question? Can you hear us, Susan? There you go.
Yes. You had 3 people die in the last 24 hours, as reported on your dashboard. Have you been able to tie any of those to Thanksgiving gatherings?
Yeah, thanks for the question, Susan. I'm going to turn that over to our epidemiologist, Kate, to see if they've had a chance to look at that or not.
Hi, Susan. Well, we can't comment on specific deaths, so I don't believe that's an area I can comment on right now around those specifics. But we do, for every case, we are linking and looking at source of transmission.
Well, that's not a HIPAA issue to discuss a generality like that. I'm not sure why you can't comment on it.
We generally don't comment on individual cases or individual settings, like where there are outbreaks, that kind of thing. But I think overall what you're asking are these things associated with gatherings? And as you know, the majority of our deaths are occurring in the skilled nursing facilities and the residential care facilities for the elderly in the congregate settings. But I don't think at this time we have data on whether Thanksgiving gatherings specifically are associated with the deaths.
Okay. Thank you.
another question about shopping. They're asking, why is the mall still open even though stores are limited at 20%? Any,
Yeah, maybe Adam could give the state guidance from the stay-at-home order on malls. Adam, would you have that information?
Yeah. Can you hear me?
yeah, we hear you.
Okay. Yeah, the state order does restrict retail and shopping centers retail sales to 20% indoor capacity. That capacity limit increases to 35% if it's a grocery store where the primary purpose of the business is the retail sale of food and beverages. So there is a 20% capacity restriction that does apply to the mall, at least for indoor. Great,
thank you, Adam. So yeah, malls are I need to abide by that 20% too. We have another question asked, when does your county plan to vaccinate first responders, firefighters, and EMTs? I believe we began some of that today. Isn't that right?
We actually began yesterday and got some updated numbers. I think we've vaccinated 350 EMS staff in the last couple of days. So that is actively happening, and we hope to, there's several dates set up. We hope to move through everyone who wants it in the next, couple of weeks. And then again, get everyone's second doses in 3 weeks from then. But we're doing that now.
Great, thank you, Dr. Baldwin. Let's go back. Martin has a follow-up question.
Hi, Dr. Mace and Kate. I'm working on a story for Sunday, taking a look at the demographics of our deaths. And we find that Hispanics or Latinos, while they are the vast majority of our cases or overrepresented among deaths, they are not seeing that same overrepresentation. That's more, their share of the number of deaths is more in line with their share of the population. And I was hoping that you could maybe speak to why that is, and maybe offer some insight on what's actually happening. Because I think I was looking at some CDC numbers, and Hispanics and other minorities are in fact overrepresented in deaths of COVID across the country, but we're not seeing that here locally, and I'm just wondering why.
I don't know, Kate, if you wanted to respond to that.
Hi, Martin. I had sent you some follow-up information on that. The general trend that we're seeing in the data is, while the Latinx community is disproportionately impacted by the number of COVID-19 cases, these cases tend to be happening among residents who are younger. So I believe it's about 4% or so of the cases are over age 65 among the Latinx community, versus a larger proportion among residents who are not Latinx. So they tend to be younger, less likely to have underlying conditions, and also less likely to be hospitalized. It's about 3% of the Latinx population who has COVID-19 has ever been hospitalized, compared to 7% among non-Latinx. And so although when you look at our number of hospitalizations, that 3% adds up. So we see about 40% of those hospitalized who are Latinx, but because they're younger and less likely to have underlying conditions, we're not seeing a disproportionate rate in terms of deaths. And when we look at our death data, a majority of those have been among residents in skilled nursing facilities and residential care facilities, some of the most vulnerable residents who have medical needs and are over age 65. And among those residents, the majority of those residents have been white, non-Hispanic. So I think that's why we're seeing in the deaths, not seeing an overrepresentation for the Latinx community specifically.
Do you know why we would differ so much from other communities, or maybe it's just that we're looking at a very small population versus the entirety of the nation in terms of seeing so many Hispanic deaths? I'm just wondering if there's something else, or is it just that we are predominantly a much younger Hispanic population here?
You know, I can't really comment on that other than what I can see in the cases, that our cases have tended to be among younger residents. And, you know, I know in our in a report, you know, that we've released previously, looking at summary measures of health in our community, we have seen that Latino residents have a more longevity. And so there seems to be some protective health factors going on in, you know, among Latinos in our community that could be potentially helping in that area, but I can't really comment on that specific to COVID.
I've heard that referred to as the Latino paradox.
Yeah.
In previous years. Dr. Mace, I'm hoping you could comment on does this mean that the Latinx community has less to worry about in terms of this virus?
No, I don't think so. I think that, you know, generally younger people are likely to do a lot better with COVID, either being asymptomatic, pre-symptomatic, or minimally symptomatic. So if you're younger, then you're likely to have a much easier time with COVID and a better outcome. But still, you're out for 10 days. You potentially have contacts in your household and all that. So I don't think they have less to worry about, except that let me just note that some of the differences might be the demographics of the Latinx in our population being more the essential workers and, you know, agricultural, construction, all these different sectors. And that may actually be why our numbers look different. Is getting back to your previous question about how we may differ from potentially the rest of the country or other areas in the country. But I don't think anybody should be less worried, because you can still get COVID and you can still transmit it to people who are quite vulnerable.
Great, thank you so much.
Okay, Christina, a member of the public is asked the question, which I think is a good one. She asks, is the recommendation for number of days to quarantine after traveling outside the US or the California different by CDC guidelines than local guidelines? And more specifically, what is the recommendation by the county for testing and quarantining after arrival, after being out of the area? Do you want to clarify that, Dr. Mace or Adam?
Yeah, I think, you know, Adam, did you want to speak to that first?
I know we've had some changes in the exact definitions of quarantine, and this would be a nice time to clarify that. It's complicated, I know.
Yeah, I can answer that question. Yeah, we just submitted a revised quarantine order. The quarantine period is now generally, for the general public, either 14 days from the last date that the person was in contact with a COVID positive individual, or 10 days from the last date that the individual was in contact with a COVID positive individual, as long as that individual obtains a test on day 8 or more since the last contact and the result is negative. Any individuals that are using the 10-day period would still need to continue to monitor their symptoms, because they could still test positive up to the 14th date. So they should continue to monitor their symptoms, wear a face covering, socially distance, avoid all gatherings outside their home until that 14-day period from last contact with the COVID positive individual. And that has been posted online.
And Adam, is that the same guidance for those who travel outside the area as well?
I would defer that as a more of a health recommendation to Dr. Mesa. This would only apply to those who have had close contact defined as 15 minutes aggregate or more in a 24-hour period with a confirmed COVID-19 individual.
And I think just to clarify, if you're traveling outside of the Bay Area and you're returning, then the guidance still holds that, you know, if you're coming back from anywhere outside of the Bay Area, that you should quarantine after coming back to the county. And the 14 days would be appropriate because in all likelihood, you're not going to necessarily be tested. So I think 14 days of quarantine upon return to the county would be appropriate.
Okay. Well, on that note, in terms of for those who travel out of the area, do you have concerns regarding, Alicia asked, do you have concerns regarding the new COVID breakout? I'm sure if she refers to the variant that's been discovered in Great Britain.
Yeah, there has been a new variant of COVID that's been discovered in the UK and has been shown up in some other countries as well. And in all likelihood, with air travel and all, we will be seeing that variant here in the United States. There is not that much data on whether it's causes worse disease or is worse than the variant that we've currently been seeing. But there's no reason to think that the vaccine is not effective towards the new variant. Therefore, really getting people vaccinated and going through those tiers, the phases and tiers as Dr. Baldwin and others in our county are implementing is the key, because even the new variant is not going to be resistant or not affected by the vaccine. So anyways, I don't think we have a lot of information about the variant, but we'll give you more information as we find it. I don't know if Dr.
May I?
Anybody else? Yeah, Adam, do you want to add?
Yes, I apologize, Dr. Mace. I would like to add that there is a state advisory that anyone traveling from out of state, either a resident returning home from you leaving the state or a non-resident coming into the state, there's a CDPH travel advisory recommending a 14-day quarantine. And I know that Governor Newsom in his press conference today indicated that CDPH will be revising that travel advisory and updating that soon. I'm not privy to what exactly is in that travel advisory. I just know that he's publicly disclosed that is an advisory that is currently being revised and will be updated soon.
Great. Thank you, Adam. That's helpful. Okay, we have a number of comments about the concerns about heavy attendance at stores and questions about code enforcement. I do want to remind people that the county's code enforcement team are responding to complaints. They are passing along complaints when they are in incorporated areas. And we do want to remind people that the best way, if you see some store or other operation in non-compliance with the state, the health order rules, feel free to contact use the tip line to notify the county. And that phone number again is 1-707-833-SAFE-707. That's 707-833-SAFE-707. And you can leave the information there. We also received a number of questions today related to specific types of workers or demographics as to when they're going to be vaccinated. We're not going to have a chance to go through all of them today, but we do encourage you to go to socoemergency.org, where we do have laid out in more detail who's in tier 1A, who we're working through right now, who are the essential workers in 1B that'll be included, who's in 1C. And hopefully you get some, and we also have links to CDC and CDPH sites that'll give you even more information about that. And we will update you as we go. So with that, I think we're going to end it here. I just want to thank our producers, Stuart and Gilbert, and Jordy, our Spanish interpreter, and Elizabeth, our ASL interpreter. And most of all, I want to thank Dr. Mace, as well as Dr. Baldwin, Kate Pack, Adam Radke, and all of our panelists for being here. We encourage you all to like the County of Sonoma Facebook page, which is a source of abundant information about COVID and other activities in the county. We also encourage you to follow us on Twitter for information about COVID, as well as on future briefings like that, like this event today. And so with that, we wish you all happy holidays and a very happy COVID-free, eventually, new year. So thank you all.